talking about part 1 of Fixed. We are sitting with our lovely friend, Miss Allison, and thank you for coming in today.
Oh, it's no problem.
Well, we appreciate it. She has come from a long distance, actually, from about 40 minutes away, or at least 30 some odd miles away, to come visit with us. And she comes because her aunt is kind enough to refer her over to us. One of the things that I know that you and I have been dealing together with is just acne. Mm-hmm. How does it make you feel when you have these acne bumps?
I really don't enjoy having them.
Yeah.
It makes me feel uncomfortable to go out without makeup or at least some form of covering on my face. It's just I'd love to be able to feel comfortable in my own skin.
That makes sense. And the good part is at least we're making quite a bit of progress. I mean, you look fantastic. She was asking earlier, oh, I should have put makeup on or I should have gotten ready. I said, you look so good. It's just such a nice change. You look fantastic. So I'm glad that we're making progress in that direction. Today, what we're actually going to be talking about is a new type of laser. It's been on the market for a short period of time. It's called AeroLase, and it uses the same technology that we have. It's modified a little bit, and what it's really good at doing is getting rid of acne, helping with some of the acne scars, and just smoothing out the skin while removing some of the red. So I'm hoping that it's going to be the right fit for you.
I'm excited.
Good. Anything in particular that you're nervous about as we're going to go over to the next room?
I mean, my main concern would be, is I just hear laser, so I wonder if it's going to be painful or what the after effects are going to look like.
That's very good questions. Perfect. So in terms of pain, it's almost nothing. It feels almost like a sparkler that you're holding in your hand, and it's not even touching the skin. So it's almost painted right over the skin. And what that does, it's just generating enough heat to destroy the bacteria, to destroy the sebaceous glands that are causing the oil production there. And at the same time, the only part that you might feel a little bit is if you have any fine hairs, it'll actually remove that hair so it unblocks the follicular ostia, which is a fancy way of saying a hair follicle.
Oh, wow.
Yeah. Afterwards, another one that you were asking about is what it's going to look like afterwards. So the nice part about this is typically what you're going to see is a little bit of redness that calms down very quickly. By the time you do your 30-minute drive, actually, since you're going to be stuck in traffic, you might notice that you turn more red, but once you get home and you're calmed down, you're not going to see too much.
Awesome.
What other questions can I answer?
I think those are my main concerns.
Well, wonderful. I definitely appreciate your joining us. I know we're going to be coming back to part 2 of Fixed in just a few minutes with Miss Allison, and we're going to be talking about the AeroLase technology. It's a 1064 nanometer, and what that wavelength does, it's going to help destroy the hair follicle. It's going to help open up the acne bumps, help destroy the acne that's active right now, and help with acne scarring, in addition to helping with some of the redness. So this quadruple threat, if you want to combine it as that, is really going to make a big difference, and I'm excited to see what's going to happen with Miss Allison here. So we're signing off for right now, but we'll be back within the next couple of minutes talking about part 2 of Fixed. So appreciate your watching us. Suneel, Chilukuri, Refresh Dermatology, we're signing off, and we're going to be on part 2 of AeroLase in just a second. Thanks again for joining us on Fixed at Refresh Dermatology. This is part 2. You can see poor Miss Allison here. I'm going to raise up your eyebrow or your glasses so you can say hi for a second.
Hi.
So we're going to go to a live demonstration right now. You're nervous about pain?
A little bit.
A little bit. I think just over the active area, it's going to be a little bit of a zinger. Why don't we adjust this, or I'll have you adjust your goggles so it's perfect. And while she's adjusting our goggles, we're going to actually put on our safety goggles. We are sitting here with Allie, and for any of you who are watching, Allie is a lovely aesthetician that's able to work with it. We're lucky to work with her. And behind the camera, we have Araceli, and I'll put her in the camera shot in just a second. But, well, she's shaking her head no, but we will. I'm going to go ahead and put on my safety goggles. I think that's one of the most important things that we do in a dermatology or cosmetic dermatology practice is really understand the safety that's behind here. So let's go ahead and load up. And I'm going to come behind the camera right now, and I'm going to show you what we're doing live. You ready, hun?
Yep.
Okay, you're going to do great. I'm going to come right through here. Go ahead. Thanks. And what we're doing is we're getting ready to use the AeroLase laser.
I'm going to start up here. Okay. All right, you ready?
Let's do this.
All right. Yeah.
So you can see that we've got the laser ready to go, and Allie is firing off the laser. So that noise that you hear is just the cooling that's going on. The little pulses of light that you're seeing are what's going to help destroy the acne, as well as help with the redness. So it's a combination of two things that's going on right now. And it's just like painting the face at the right depth. So you can see, even though it looks very, very simple, and I'm going to give you a different view of it right now, we have to really change the settings that are here and make sure that it's perfect. So when you go see somebody who's using a laser, make sure they do a lot of laser therapy and they're customized to treat your skin. So with this particular device, which I'm going to show you right here, you're going to see that we're able to treat every single skin type that's out there. That's the nice part. And what I'm going to do here is I'm going to bring you back to Miss Allison that's being treated. And you can see the Aerolase is just doing wonderful for her. Allison, how bad is it hurting?
Not at all, it's just hot.
It's hot. So we are going to be generating some heat, and I'm going to show you in a different way right now, from a different angle. So you can see that these individual acne bumps, as well as some of the red, is being treated to make this go away. This is the one area, because she has an active lesion that's going on right there, that's going to feel a little bit hotter. So she'll see a nice change that's coming through here. Most of the change that's going to occur is going to happen over the next day. And we can treat as often as every 1 to 2 weeks. Most often, we treat about 2 weeks apart. So Allison is going to go back to college tomorrow, and we'll visit with her when she's back in town. With that, I'm going to sign off fixed. Hopefully you guys are enjoying some of this laser treatment and getting an idea what goes on behind the scenes here at Refresh Dermatology in Houston, Texas. If you guys have any questions, we're going to post this in just a few minutes. And you can ask any questions, and I'll do my best to respond to you within the next 24 hours. If you have active acne, or a friend has active acne, you have acne scars, you have redness of the skin, you have broken blood vessels, you have something called melasma, which is just dark pigmentation. If you have under eye circles, we can treat all of those. Again, Refresh Dermatology, Houston, Texas, talking about the Aerolase laser currently being used to treat acne scars and acne. Thanks so much.